Hi, I'm Dr. Adam Miller from Arise MD, your home for integrative and functional medicine that is personalized to help you reach your peak. And today we're talking about the #2 killer in America, that's cancer. Every 60 seconds in this country we have a new cancer diagnosis. And within that group, the #2 killer among cancers is colorectal cancer. We have 140,000 new cases every year, affecting men and women about the same. What can we do in terms of screening so that you can prevent these cancers? Well, in general, we want to know how well your body's protecting the DNA within the nucleus of your cells from oxidative stress. And we have a relatively new marker that can be tested in urine called 8-OHDG, which literally measures how much oxidative damage is happening to your DNA every day. The higher the damage to DNA, the more chances that you're going to reach that critical mass of mutations and flip into a cancer. So if you haven't had that done, I highly recommend that. Most of our patients do. But within the GI colon cancer screening arena, we have a newcomer in addition to colonoscopy. It's called Cologuard, and you've probably seen the little square guy sitting on the toilet in their commercials on TV. Very clever branding. But Cologuard is a wonderful tool for those who are over the age of 50, don't have a personal history of colon cancer, don't have a family history of colon cancer, are not in the inflammatory bowel disease group, and have never had any radiation to their abdomen. They're considered the low-risk group and are good candidates for a test, Cologuard, which it turns out has about a 92% sensitivity, meaning 92 out of 100 people who have a large polyp or have precancerous lesions or have actual cancer in the colon, it will detect that. And it has a high specificity as well, weeding out those people who, if they don't have a cancer, it will report negative. So its true negatives is quite high as well. So Cologuard's an easy test to run. If you are over 50 and we decide as a part of your preventative medicine program that you should have Cologuard done, a requisition form with our information on the top and your information on the bottom will be faxed or mailed into Cologuard, and they will ship to your home this nifty kit, this box, which is entirely recyclable. In the next video, you're going to see Nate, who is our Wisconsin rep, showing you when you open that up what to do with the contents, how to collect your specimen, and how to safely and accurately get it back to Cologuard. Now, from the day they get the specimen back, it takes about 1 to 2 weeks for us to get the results. Once we have them in hand, we will schedule a follow-up with you to talk through those results and to establish an optimal treatment plan. So Cologuard, an option for those people who aren't at high risk and don't, because of time and convenience and comfort, want to have a colonoscopy. Cologuard is an option for you that we consider part of an optimal preventative medicine program here at Arise MD, where we're all about helping you reach your peak.
All right, so my name is Nate. I am with Exact Sciences Laboratories, and this is the Cologuard test. So when you have Cologuard ordered for you, you're actually going to have this kit shipped directly to your home. The first thing you're going to see is the collection kit. There's going to be a prepaid shipping label on the top. To open up the kit, all you have to do is pull off this little strip. First thing that you are going to see is a Ziploc bag, so you'll unzip that. And then there's going to be 2 labels in your instruction guide. So the 2 labels are going to have first name, last name, date of collection, or date of birth, date of collection, time of collection. It's extremely important that both labels are filled out completely and accurately. The next thing you're going to see is our instruction guide. So this is an older version. Your kit will have 2 instruction guides. The first is going to be how to actually complete the test kit, and the second is going to be how to get it back to Exact Sciences Laboratories. So once you have labeled both labels, you'll then open up the test kit, and this is going to be the bracket that will be placed on the toilet seat. So you'll lift up the toilet seat, you'll place this bracket down, put the toilet seat down. Next, you'll take out the sample collection container, unscrew the lid. and then you'll place this inside the bracket on the toilet seat. At that point, you'll provide one stool sample. After the sample has been provided, you will take out the test that the hemoglobin assay, or the test that's looking for blood. So you'll unscrew the lid. It looks like a little mascara wand. You'll take it, scrape the sample. Don't poke or prod, just scrape the sample. This will go back inside of the tube. The first label that you filled out with date and time of collection will go on this. This will go back in the box. At that point, you will take out DNA preservative. It is not PrEP, it's non-toxic, but do not drink this. This will be poured in completely into the sample collection container, so you'll pour all the DNA preservative in. You can either put this back in the box or recycle it. We recycle everything at Exact Sciences Laboratories. You'll take the lid, screw it onto the collection container, and then your second label that was filled out completely will be put on anywhere on the sample collection container, as long as it's on the container. The container then will go back into the box. One thing I will also note, the Ziploc bag is connected to the box, so it can't be removed. All you have to do then is shut the box. You'll tear off the prepaid shipping label, and then at that point you have two options. You can either call your local UPS, and the number will be listed in the back of the instruction guide, along with so there's going to be a number provided for UPS, and then there's also a guide. So we do need the collection kit back within 72 hours at our laboratory. So we like to say within 48 hours you should have your test kit back to UPS at the very latest. So there's a guide for if you collect your sample on X day, you need to get it back to our lab, to UPS, within the following day, within 48 hours. So you can either call your local UPS, drop it off on your way to work, whatever's easiest for you, and that's all you have to do.
Say hi, Mom.
Hey, Mom.